Hi there. Thank you for joining me once again on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. As we continue to discuss the COVID-19 pandemic, we are reminded that it is still a very big and very dangerous problem, not just in Guyana, but around the world. Remember, if you have any questions or comments regarding the COVID-19 pandemic, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. You can notice that I'm wearing my mask to cover both nose and mouth, but I'll take it off using the straps so we can continue this conversation. COVID-19 is real and it's wreaking havoc not only in Guyana but across the world. Closer to home, it is causing severe problems in our good friends and neighbors across in Trinidad, in Suriname, in Brazil, all around the world. There is no exception, nowhere is really spared. And it's important that we continue to follow all of the safety guidelines that were set out in the early days. They are still relevant now, they are still true. The social distancing, wearing of masks and sanitization, washing your hands, etc. remain true, they remain relevant. What has been added to the fight against the prevention and management of COVID-19 in recent times is the development and availability of vaccination strategies against COVID-19. We have been lucky in Guyana so far to have very good access to vaccines. We have 3 separate types of vaccines available. We have the AstraZeneca from Oxford University, we have the Sputnik 5 vaccine from Russia, and the Sinopharm vaccine from China. Now, every day people keep asking me, which is the best vaccine to take? Which one should I get? And the answer is quite simple. You take the vaccine that you have access to, because all of them, every single one of them, have one specific characteristic that we look for. They are all 100% effective in preventing people from getting severe COVID. 100% effective in preventing severe COVID. When I talk about severe COVID, I'm talking about admissions to ICU, being put on a ventilator, or even dying. Those are the 3 big outcomes we talk about when we talk about severe COVID. And so far, since we have started our vaccination program in Guyana, once people have been vaccinated for more than 2 weeks, we have no admissions of anyone who has been vaccinated for more than 2 weeks to the COVID hospital ICU. And that is remarkable but not surprising, because it is in keeping with the data that is available worldwide, not just Guyana, not just South America, but all across the globe. People who have received vaccination, and it's better if you receive your 2 doses of the vaccine. The vaccines have all been shown to be 100% effective in preventing severe COVID. Despite the evidence that is available, despite the scientific scrutiny and expertise that go into all of this to make sure that people are safe, there still exists a lot of doubts. And it is important that we address these as they come up, because some are based on real concerns and a few might be just mischief. But for those who have real concerns, it is important that we try to answer these questions that are in people's minds to make them feel more at ease to take the vaccines and to protect themselves, to prevent themselves from getting severe COVID. Most recently, we have seen evidence that not only do the vaccines prevent severe COVID, but they also reduce the likelihood of transmission. In Europe, especially in the UK, a study was just released looking at two vaccines, the Pfizer as well as the AstraZeneca. And both of them, with the first dose, have shown to reduce the transmission by more than 50% from the vaccinated first dose person to the unvaccinated or to those around them. So we are seeing with just one dose that there is also an effect in reducing transmission from person to person. And this, I believe, would be mankind's best chance of getting out of this COVID-19 pandemic and returning to any type of normalcy in life. So people are concerned about vaccines, sure, but it still offers much more benefits than risks. And one of the things I want to do today is talk a little bit about some of the myths that are surrounding vaccines, vaccine development, etc. And one of the main things that people seem to be concerned about is that vaccines were developed in a rushed manner and it did not follow the normal pattern. Well, the truth is that while it may seem that these vaccines were created quickly, the technology that was responsible for this has been in development for a number of years. Now, in particular, the AstraZeneca vaccine, they were working on this vaccine since the Ebola outbreak in 2014. And even before that, when we encountered SARS in 2008, that was our introduction to the coronavirus. And so the science of the coronavirus, how it attacks the human body, etc., was already known since 2008. And so with that knowledge, the scientific community started their preparations to fight it whenever it reappeared. A new variant of coronavirus came out, or another member of the coronavirus came out in 2019, and it's called COVID-19. So, but the basic mechanism how it attacks the human body is very, very much the same as the coronavirus that was prevalent in the SARS outbreak. So it is not new science. We already know for more than 10 years what this virus is, what it's capable of, and how it attacks the human body. So it is not as new as people would think. The second thing that people are worried about, especially with the mRNA type vaccines, that's the Pfizer and Moderna, is that it will change people's DNA, create zombies or some kind of altered human beings. But that's absolutely false. It is impossible for these vaccines to change people's DNA. And, you know, that is one thing that people have used in propaganda to scare other people, but it is not true that the vaccines cannot, I repeat, none of these vaccines can change people's DNA. The other thing that people are worried about and they express concern is that it can actually give you COVID-19. People are concerned that getting the vaccine can give you COVID-19 or give you a mild form of COVID-19. And that's absolutely not true. That is false because none of the vaccines use live viruses. And if there are no live viruses, you cannot actually get the COVID infection from the vaccine. The other thing some people are worried about is that the vaccine components may contain things like eggs or fetal tissue. Now, some people, whether they're vegetarian for dietary preferences or religious reasons, do not want to have anything to do with eggs or fetal tissue. Well, it is absolutely false to assume that any egg or fetal tissue is involved in the production of these vaccines. None of those are involved in the production of the COVID-19 vaccine. So there should be no reason, if you're concerned about eggs or fetal tissue from a religious or other point of view, there's no reason for you to maintain that concern. The other thing that people are worried about is the side effect profile from these vaccines. They seem to think that the vaccines can cause severe side effects. Well, the vast majority of side effects from these vaccines are mild. And when I talk about mild side effects, I mean things like pain at the injection site, a little fever, maybe some fatigue, tiredness, but it does not cause any symptom close to severe COVID or even moderate COVID. It does not cause COVID, and the side effects are quite mild when they do occur. Now, there's a lot of information on the internet and elsewhere about the association of blood clots with vaccines, in particular the Johnson & Johnson vaccine and the AstraZeneca vaccine. But the chances of getting blood clots from those vaccines are less than 1 in a million. Less than 1 in a million. So if you imagine that Guyana has 800,000 people that are going to be possibly vaccinated, we do not expect statistically that there should be more than 1, maybe 2 persons with this. Each person is, of course, important, but we do not expect statistically to find this occurring in Guyana. The other main one that people are worried about, and this is a big one, especially in young women and young men, is that it can cause infertility. And that is indeed a significant concern among a large section of our population. Well, the good news is that there's absolutely no evidence that the vaccine causes infertility. No evidence that the vaccine causes infertility. Not in men, not in women. One other concern that is not listed here, people are worried about the effect of the vaccine on pregnancy. Well, it is important to note that there are absolutely no recorded increase in any pregnancy complications with people taking the vaccine. There is no preterm labor recorded or associated with the vaccine. There is no associated miscarriages. There is no associated birth defects. There is no problems that have been recognized in breast milk transmission either from mother to child. These are all important considerations that people have when making a decision about the vaccines. And just to note that there are many vaccines that are given to pregnant women without any major side effect. And these are things that people find out in trials, and they have to pass very rigorous scientific scrutiny before we give it to anyone, much less giving it to pregnant women or breastfeeding women. The other question I've been getting a lot of recently is about cardiac patients or heart patients taking the vaccines. And I wondered if there was something new that was going on that I wasn't aware of. So I actually checked this before I came on the show today. And none of the authorities have recommended holding or withholding the COVID-19 vaccines from any cardiac patient because of any cardiac condition. In fact, the cardiac patient is at particularly higher risk of COVID-19. So therefore, this group of people need the vaccine much more than the non-cardiac patient. So the patient who had a heart attack, the heart failure patient, the patient with a heart rhythm problem, these are all patients who would benefit much more from the vaccine than withholding the vaccine from these people. So it is important, again, to remember that having a history of cardiac disease does not prevent you from getting the COVID-19 vaccine. So I hope this would have enlightened us all a little bit more about some of the concerns about vaccines and what the answers really are, what the answers should be. Remember, if you have any questions or comments, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com.